had a devastating health impact on Black and Hispanic communities. Following the American Cancer Society Cancer Action Network's release of local data earlier this month, outlining the link between tobacco use and cancer diagnoses and deaths, we felt it was very important to convene this event this afternoon. We need to address the policy pathways to reduce tobacco, to reduce its use, and with it, the incidence of cancer and death, especially among communities of color. At this time, I would like to welcome guests joining us this afternoon in alphabetical order. We have Dr. Michael Archer, Division of Thoracic Surgery, SUNY Upstate Medical University. We have Linda Brown Robinson, the Western Regional Director, NAACP, New York State Conference. We have Tracy DeGenova, CNY Regional Representative, Office of Governor Hochul. We have Sherry Dozier Owens, Secretary of Syracuse Onondaga NAACP. We have Brianna Durkee, Government Relations Director, American Heart Association. Amy Grover, American Heart Association Community Action Committee Chair. We have Mark Hall, who is President and CEO of the Syracuse Community Health. Dr. Bill Hines, MD, who is Counseling, Addiction, and Psychological Services, also with the Syracuse Community Health Center. We have Dan B. Robinson, Executive Committee, Syracuse and Onondaga County NAACP, and former President of the City of Syracuse Common Council. We have Christy Samoro, Communications Director, American Heart Association, and Brittany Taylor, Community Impact Director, American Heart Association, and former Health Committee Chair of the Syracuse Onondaga NAACP. I would also like to thank those who could not be with us today. Tim Penix, Executive Director of SUNY EOC, and we want to thank him for allowing us to use his facility this afternoon. We have Michael DeVoli, Senior Governmental Relations Director of the American Cancer Society, and Casey O'Neill, who is Senior Regional Media Advocacy Manager, American Cancer Society Cancer Action Network. And we also have Dr. Leslie Coleman, American Cancer Society Board of Directors, SUNY Upstate Medical University, who could not be with us this afternoon. At this time, I would like to introduce Linda Brown Robinson, the Western Regional Director of the NAACP New York State Conference. Linda?
Good afternoon, everyone.
Good afternoon.
How's everybody doing?
Good.
Good. Glad to see you here and glad to have, we welcome you all to our day's event. So as Gwen said, I'm Linda Brown Robinson. I'm the Regional Director for the NAACP. And my husband and I, we were kind of the originators of the NAACP Syracuse Onondaga chapter. And so on behalf of him, myself, we welcome you, and of course our state president, Hazel M. Dukes. It's been our life mission to work and ensure the mission of the NAACP, which is an advocate for the political, educational, social, and economic equality of all rights for all persons, and to eliminate race-based discrimination in Syracuse and Onondaga County and across the state of New York. In February 2021, the NAACP joined with several organizations to issue the report, Stopping Menthol Saves Lives, Ending Big Tobacco's Predatory Market to Black Communities. Quoting the executive summary, for more than 60 years and continuing today, the tobacco industry has targeted Black communities, especially children, with marketing for menthol cigarettes and other tobacco products. products like flavored cigars, The industry predatory market has had a devastating impact on Black health and lives. Tobacco use is the #1 cause of preventable death among Black Americans and tobacco-related disparities in the Black community. And they are largely the result of the tobacco industry's intentional targeted efforts to hook generations of Black Americans' deadly addictive products. Utilizing information from the New York State Cancer Registry, the American Cancer Society Action Network released data earlier this month showing the devastating impact that cancers linked to tobacco have on New Yorkers, specifically those living in Onondaga County. Between 2015 and 2019, 46,417 people, on an average each year in New York State, were diagnosed with a cancer linked to tobacco use. And 13,638 people died from cancer linked to cigarette smoking. Between 2015 to 2019, 1,219 people, on an average each year in Onondaga County, were diagnosed with cancer linked to tobacco use, and 61 people died from cancer linked to cigarette smoking. Lung cancer is the #1 cancer killer in New York for both men and women, and over 80% of lung cancer deaths in the U.S. are linked to cigarette smoking. That said, tobacco use causes at least 12 types of cancer. When combined, cancers linked to tobacco use make up 40% of all cancers diagnosis, and cigarette smoking causes 3 in 10 of all cancer deaths. I reiterate our purpose here today by quoting from our health chair, our New York State health chair, Lorraine Braithwaite-Hart, for the NAACP State Conference. Our state leaders must take an aggressive action to reduce tobacco uses across New York State, and that includes ending the sale of menthol cigarettes and all flavored tobacco, increasing the tax on cigarettes, and investing more in smoking cessation programs are needed. These are the 3 concrete steps that have been proven effective and limiting tobacco use and uptake. And when paired together, we have potential to save countless Black lives. So I want to thank you all, but I'm going to take a point of personal privilege. My husband doesn't know I'm going to do this, so he's probably going to be a little bit, maybe I'll get it when I get home. The gentleman is my husband, sitting in the back. That's Van Robinson, and we've been together for better than 55 years. But I want you all to take note that he has oxygen. That oxygen comes from the fact that he was a smoker. And it led to him having 2 blood clots, and that's why he's on oxygen. I also was a smoker, and when the doctor said to me, Mrs. Robinson, you're pregnant, I could smoke in the office then, and they called me in my office, and over the phone, so then you could smoke in your offices, and everybody smoked, and he said, do you smoke? I put the cigarette out, and I never, ever picked it back up again. But I want everybody to know that gentleman, that doesn't keep him down just because he has oxygen, but that is the reason for the oxygen. So that's my point of personal privilege. So thank you all for coming.
Thank you, Linda.
Thank you, Gwen.
And thanks for that personal message, because smoking is killing us. All right. It's now my pleasure to introduce Mark Hall, President and CEO of Syracuse Community Health. Oh, he's not here. Oh.
Told you guys to check.
He told me.
That's all right. Move on.
Okay, that's okay, don't
All
worry.
right.
You texted, but that's all right.
All right, and next we have Amy Grover, from the American Heart Association. She's the Community Action Committee Chair. And it should also be noted that the American Heart Association has long been a partner in this fight against tobacco use, along with the American Cancer Society. Welcome, Amy.
Good evening. My name is Amy Grover, local sports medicine and wellness coordinator and chair of the Community Action Committee for the American Heart Association in Syracuse. I'm also a mother and community member who is concerned about tobacco use in our community. I stand today with community members and health advocates because the science is clear. Tobacco use is the leading preventable cause of heart disease and stroke, the nation's #1 and #5 cause of death. The American Heart Association supports budget proposals to increase the state cigarette tax by at least $1 and eliminate the sale of flavored tobacco products, including menthol cigarettes. We know that increases in tobacco product prices lead to substantial reductions in cigarette smoking for youth and young adults. This is one of the most important strategies to prevent kids from using any harmful tobacco products and encouraging those who do to quit. Additionally, New York must end the sale of all flavored tobacco products. We know big tobacco has marketed flavors for kids and in our Black and Brown communities to hook these populations on these deadly addictive products. The bottom line, ending the sale of menthol cigarettes and all flavored tobacco will help prevent another generation of kids from getting hooked on deadly tobacco. Lastly, I urge New York to devote some of the revenue generated by the tax to support tobacco control and cessation programs. We know how addicting tobacco products are, making it extremely difficult to quit. We also know that most people who smoke started at a very young age and have continued to smoke for most of their lives. New York must invest and devote resources to educating the public and helping those who are addicted to quit. Our well-funded tobacco control program will not only produce long-term savings, but can have an immediate benefit on the health of New Yorkers. We must take back our community from big tobacco and protect our children. I implore all state lawmakers to prioritize the health of our community over the profits of the tobacco industry. It is our shared responsibility to do what is best for the next generation of New Yorkers. Thank you.
Thank you, Amy. At this time, I would like to ask Dr. Michael Archer from the Division of Thoracic Surgery at SUNY Upstate Medical University to share some remarks with us.
He's ready.
Thank you very much for the introduction. Thank you all for being here today. My name is Michael Archer. I'm a thoracic surgeon at Upstate Medical University, and I'm here today to show that the medical community stands in solidarity with these community leaders to support proposals and efforts to reduce tobacco use in the state of New York. Tobacco use is linked to cancer. Many of my patients have cancer, mostly lung and esophageal cancers, and many of them are used to or still use tobacco products. Their tobacco use is directly related to their cancer in some cases. I see this almost every week in my clinic, and so it was unsurprising to me when I heard from the folks at the American Cancer Society that about 1,200 people in Onondaga County are diagnosed with a tobacco-related cancer each year. And about 360 of our folks in our county die each year related to those cancer diagnoses. This number represents people. They represent friends, neighbors, our families. These numbers mean that every day on average, my colleagues and I tell at least 3 people in this county that they have cancer. And we hear the fears, and we hear and see their fears and their families' tears. They mean that just about every day, someone in this county dies related to a tobacco-related cancer. We have an opportunity here to prevent those phone calls, those appointments, and those funerals. The big part of my job is helping cure people of their lung cancer, and I find great joy in doing that. But that comes at a cost for those patients. I have to take out a part of their lung in order to remove their cancer. When patients come to see me or one of my colleagues, we aren't helping them prevent their tobacco-related cancer, we're reacting to it. We recognize that efforts to help our patients really need to start with prevention and early diagnosis when cures are still achievable. Lung cancer is the #1 cancer killer in the United States. for both men and women. And we know that tobacco use and lung cancer are related. And even though we know that smoking is linked to lung cancer and that lung cancer is a killer, we still see people picking up smoking and struggling to quit. We haven't done enough to help. The current legislation will discourage younger generations from starting and may help older individuals quit. This will drive down the smoking rates, which will drive down cancer rates, which means fewer cancer diagnoses and fewer deaths. The people that come into my office are generally of an older generation. They were targeted by the tobacco industry for decades. And when I see my black patients, I know that they were specifically targeted with menthol and flavored tobacco products. And they were pushed hard by the tobacco industry to purchase and use those products. The proposal to ban those products is just one small step to undo the harm the tobacco industry has done to that community. I'm hopeful that this measure will help those patients quit and reduce the risk of lung cancer and of death. While I'm here, I want to take the opportunity to make a plug for lung cancer screening programs. I know that many people in central New York are either currently smoking or have recently quit smoking. And as I mentioned before, there's an inseparable link between smoking and lung cancer. Screening for lung cancer involves a simple discussion with your doctor, a quick CT scan that is painless and generally covered by most insurances. This quick screening has been shown to reduce the risk of dying related to a lung cancer by 20%. Unfortunately, less than 10% of folks that are eligible for this screening have gotten screened. The rate of screening for our black and indigenous neighbors is even lower. We need to help our community to stop smoking and to screen everyone at risk for lung cancer. I want to see more people with very early cancer diagnoses so I can send them home healthy and cancer-free. We hear all the time that we have to find a cure for cancer. For some cancers like lung cancer, we already know how to prevent most of them. We know that what it takes for it to be cured. These proposals, along with more screening, will go a long way towards that goal. Again, I thank our community leaders for organizing this event and continuing to promote these important measures to help decrease cancer risk in our communities in Syracuse and in Central New York. Thanks.
Thank you, Dr. Archer. And now, joining us is Dr. Bill Hines, who has worked in counseling, addiction, and psychological services at Syracuse Community Health for many years. Dr. Hines is passionate about his work, and we are honored to have him share his experience on this issue.
I had no idea what I was walking into. So I almost said, well, I don't think I can make it. Well, I was told, well, it's in your backyard, so we're gonna put your name down anyway, so you don't have to drive anywhere. So here I am. I don't usually use a lot of notes because I'm a little too ADD to. This is a great conference. It's interesting to see you talk about menthol now. This is something we've been speaking to the groups about for about 30 years, especially in this community. You drive out to the country, Pompeii, to Fayetteville, you see the signs and it says what? Got milk. Drive a little further, come to the community where you see 40 ounce and menthol cigarette. Those are the marketing tactics that you could tell were, specifically aimed at the community. What I would encourage you to do, if you have never done it, is go back and look at the papers from 1994, the Minnesota trial that involved big tobacco. And in there you will learn how early on in history that they knew about the addictive properties of nicotine. They lied about it, but they continued to push the product because they knew exactly what it would do and how it would work. They engineered the tobacco, they engineered the product, and if you look at a list of the products that go into tobacco, one of the more prominent ingredients is Mr. Cleet. I don't know if I can say it. Ammonia. Take that off. And so when the chemical engineers saw this, they wanted to know, why is so much ammonia being used in cigarettes? Any idea? It's something related to crack cocaine. It's for freebasing. So they use the ammonia so that whenever you smoke a cigarette, regardless of whether it's a regular cigarette or low tar and nicotine, which is another tactic, low tar and nicotine. The body has a mindset of what it wants, and so you essentially dose yourself in the smoke. The ammonia allows the nicotine to be freed from any components that can hold it up, so it will cross the membranes easier, and so therefore you get a higher concentration in the lungs and therefore in your brain. And so you essentially dose yourself, and the ammonia is basically freebasing nicotine to make it easier for you to become addicted to that substance. Nicotine, in my opinion, of all the substances that we treat and see at the community health center and around the country, is probably the most addictive substance known to man. That's my opinion, at least. When you look at teens, why are they so important? Well, I see a lot of great, well, not you. We got some youthful people. I see a lot of gray in here. How'd you like it? At some point, many of us are gonna step off and go home. So they need a new population of people to addict to their product. And who's it gonna be? It's gonna be our kids. So that's why you see the product being marketed to teen populations. I don't hear enough about vaping. Flavors, nicotine, youth. Initially was going to be utilized to help one get off of cigarettes. In fact, it does just the opposite. And because you can have menthol, and menthol, what does menthol do? It's cool. So if I smoke a cigarette that has menthol in it, I'm actually going to take a deeper inhalation, take it down deeper into my lungs, and therefore probably cause more pathology. With the vaping, they have flavors, but it's also in an oil base, most of it. And so when it's vaporized, smoked, and recondenses in the lung, what you're doing is placing flavor products inside of the lungs and also oil, one of the worst components you could ever put inside of your lungs. And so I try to tell the teens the one thing you need to do is to go look at the website at CDC and other places and look up popcorn lungs. It's important for them to see what that looks like. It's important for them to see how it will kill you. And it's important for them to see why, if they're going to choose between the two, vaping is actually worse than the cigarette. So it is hope, my hope today is that if there are kids who are looking for a place to come to get treated or just to talk, send them to me so we can talk about this and hopefully get them off of this product. But go back and read those papers from that 1994 trial. You'll be shocked at what's there.
Wow, thank you, Dr. Hines. Now, last but not least, is Tracy DiGenova, the CNY Regional Representative for the Office of Governor Hochul, who is going to share a brief remark on behalf of the nation.
Hello, everyone. As you said, my name is Tracy DiGenova. I'm the Central New York Regional Rep for the Governor's Office. In our State of the State and Executive Budget this year, the Governor proposed to increase the cigarette tax and ban all flavored tobacco products. Despite critical policy successes and progress in reducing smoking, tobacco use is still the leading cause of preventable death in New York State. Approximately 1.7 million New Yorkers continue to smoke cigarettes. Every year in New York, smoking kills 28,000 adults. The tobacco industry's influence in New York State continues to drive commercial tobacco-related disparities and inequalities. The tobacco industry spends $9.1 billion annually to market and promote their deadly and addictive products nationally, and of that total, an estimated $177.3 million is spent in New York State alone. For more than 60 years, the tobacco industry has significantly targeted Black communities with menthol tobacco products and marketing and promotions. The use of flavors also continues to be a tactic used to attract youth to smoking. More than 80% of the youth who have tried tobacco started with a flavored product, and more than half of youth ages 12 to 17 who smoke use menthol cigarettes. Ending the sale of all flavored tobacco products, including menthol, is a critical step to protecting the lives of New Yorkers. It would significantly reduce healthcare expenditures, disease, and death from tobacco product use, reduce addiction and youth experimentation, increase the number of smokers that quit, and meaningfully advance health equity by addressing tobacco-related health inequities and disparities. If the legislature agrees to pass the flavor ban proposal, New York State will be the third state to do so. Our proposed legislation will get us closer to creating a tobacco-free generation, saving countless lives and improving health for generations to come. This is necessary not only for the protection of public health, but also to advance health equity and racial justice. Thank you.
Thank you, Tracy. And thank you to all of our guest speakers who joined us to drive home the point that our children and our communities are being targeted by big tobacco. We applaud the American Heart Association, the American Cancer Society, Syracuse Community Health, SUNY Upstate Medical University, and our New York State Conference President, Hazel Dukes. And this will end our press conference. For those of you who have questions for our speakers, please see them and ask the questions that you may have. Also, we want to invite all of you to attend the NAACP swearing in / membership meeting that begins in this room at 5:30.